Hello, I'm Jonas, a doctor of physical therapy, pelvic floor physical therapist, and today we're going to talk about common signs of an enlarged prostate and what you can do about them. First, what is the prostate? The prostate is a small gland that sits at the base of your bladder, behind the pubic bone, and in front of the rectum. That's the rectum. And it wraps around the urethra, which is a tube that carries urine out of the body. I like to describe it like an apple with the core removed. The urethra runs throughout the center, and when the apple gets bigger, it squeezes the hole in the middle and makes it harder for urine to come out. Why does the prostate get bigger? As men age, the prostate naturally grows, and this is called benign prostatic hyperplasia, or BPH, which is not cancer, but it can still cause very real urinary symptoms. Now let's talk about the common signs of an enlarged prostate. Sign number one: trouble getting urine started, or some kind of a pause, also called hesitancy. When you stand there, you feel like you need to go, but the stream takes a while to come out. Sign number two: a weaker urine stream, when the flow feels slow, thin, or it stops and starts instead of being strong and steady. Sign number three: feeling like you didn't empty all the way where you finished. Zip up, and then a few minutes later, you feel like you need to pee again. Kind of like you're not completely emptying your bladder. Sign number four: peeing more often in the daytime, where you keep looking for bathrooms, planning your day around where the restroom is. Sign number five: urgent peeing, where the feeling comes on strong and fast and it's tough to hold even if the bladder isn't full. Sign number six: waking up at night to pee, also called nocturia, where getting up once can be normal with age, but 2 or more times most nights is worth a closer checkup. Sign number seven: straining or pushing to pee, where you bear down with your belly or hold your breath just to keep the flow going. Sign number eight: post-void dribbling or light leaking after you finish, where a few drops come out when you stand up or walk away from the toilet. Some men also report burning or pain with urination, but this is less typical of BPH, and you might need medical evaluation to rule out an infection or any other causes. So a quick self-check you can do this week is keep a simple bladder diary for 2 or 3 days and write down when you drink, when you pee, how strong the stream felt, how many times you got up at night, and whether you feel empty after peeing. When should you see a urologist? If you have 2 or more of these signs most days, or if you're up at night 2 or more times, if you see blood in your urine, if you can't pee at all, if you feel a painful bladder, or if you're getting repeated urinary infections, you should definitely get checked as soon as possible. And here's what the doctor will do. The urologist might ask you to fill out a short symptom score quiz. They'll examine your prostate. They'll check a urine sample to rule out any infections or blood issues. And sometimes they'll do an ultrasound to see how much urine is left after you go. The good news is many men improve with simple habits, pelvic floor training, and when needed, safe medications prescribed by their urologist. If you want more step-by-step tips for leakage, urgency, nighttime peeing, or pelvic pain, I run a for-free men's pelvic health Facebook community. The link is below, and you're more than welcome to join us. Thanks for watching. I'm Dr. Jonas, and I'll see you in the next video.